So the first is the false notion about breast cancer, that estrogen is dangerous and leads to breast cancer. Could you speak to us about that?
Sure. And there's actually been a lot in the news over the last 8 months or so. For those people who saw it, I'll just remind you there was this exciting article in the New York Times Sunday magazine in the beginning of February or so by a Times writer named Sue Dominus. And the title of the article was "Women Have Been Misled About Menopause." And that really unleashed a whole host of discussions and things like that. And I think it was truly a landmark article. And indeed, the Menopause Society, we just had our annual meeting 2 weeks ago, and Sue Dominus was our keynote speaker. So it sort of, hit doctors, hits patients, most importantly. And what basically she discussed in detail was the Women's Health Initiative study, which was published the first paper came out about 21 years ago. As I say, July 9th, 2002, not that I remember the day, and not that I ever had any more phone calls than I had that day, about 50 phone calls before noon, when it was announced on the talk shows, the Today Show, Good Morning America. And what it basically said, this was a large study that was being done. It was what we call a prospective, randomized, double-blind controlled trial, one of the fancy stuff in medicine that we do. And it was given women estrogen therapy. If women had no uterus, they had hysterectomy, they just got estrogen alone. There was another arm for ladies whose doctors had not taken out their uteri, and they were on estrogen and progestin, which is a combination we use for people who have a uterus in place for hormone replacement therapy. And what happened is the study was designed to say, does estrogen help prevent heart disease? That's what the whole study was about. And indeed, what they found in the study was surprising to the investigators, that it did not indeed show that heart disease was prevented by estrogen therapy. But more tellingly was the fact that they had a downside risk study group for complications. And they said, oh my goodness, it looks like the ladies who were getting the estrogen and progestin, ladies who had a uterus in place, had a very slight increased risk of breast cancer. Okay. And so they stopped the study. Now, of course, the increased risk of breast cancer was announced on these TV talk shows, and everybody immediately went to their toilet and flushed down any estrogenic substances they had in their house. Yeah. And so that was basically what happened. So that's the background summary. A lot of other information came out of the WHI. Now, a couple of things that you have to, which were not discussed, was indeed that when the results of the study were published, that indeed the increased risk of breast cancer that was supposedly seen actually wasn't seen because, and for people who are familiar with statistics, the value was not statistically significant. So the magazine published some stats that really did not hold water numerically. That was number one. Number two, that the estrogen only group of this study, which were women who had a hysterectomy, which was almost as large as the group of women who had not had hysterectomies, actually was continuing because that actually ended up showing a decrease in incidence of breast cancer. Not only not a neutral, but a decrease in breast cancer, although that wasn't quite statistically significant at that point. But all sorts of assumptions were made. And what happened is because the hullabaloo that the study started, that everybody just stopped taking their estrogen. And it had a sort of a considerable effect because what happened is not only did women who were, taking estrogen at the time said, nope, I'm stopping this because of the study. But what happened is that many of the residency programs in obstetrics and gynecology basically stopped offering menopause education at this point. Wow. So what happened is residents who were trained in the United States after the year 2002 had very little exposure to menopause education. So it was left for us old farts to carry on. Did not get any education, which was too bad. So anyway, and so if you are, so many of you, I'm sure, are going to your healthcare providers and wanting to talk about hormonal issues or talking about menopause, and you're finding that your provider really doesn't know much about it. Well, it's not her or his fault because they just weren't educated about it. But I feel bad for the patients who aren't getting the information. That's the problem.
Sure.
So we are now trying to remedy some of this information and trying to expose our youngins to more education, making women aware of what's going on, telling women about resources so they can get hormonal therapy if they'd like to do it. And again, the key thing is that was an old study, 21 years ago when it came out, but we actually have some safer combinations these days, which probably have really no risk at all of increased breast cancer, but that people aren't even aware of them. So anyway, it's really too bad. So you want to go to a healthcare provider that knows your issue. So when somebody says, "Oh, I can't take it because it's too dangerous," you want to go to a healthcare provider who really understands the data,